Good morning. Welcome to OC Live. I'm John DeSteiger, and this is Dr. Jeff McCormick. Jeff, can you touch me?
I think we're good.
I think we are properly socially distanced, so we'll take these masks off. Well, thanks for tuning in. We've got some really important stuff to talk about. Dr. McCormick and I are actually sitting in the administration building at Oklahoma Christian. This is a historic building. It's one of the first 5 buildings on this campus. They began to build it in 1957 for our move from Bartlesville in 1958. Well, I want you to know, I tell you, this guy is making me look brilliant. You know, Dr. Jeff McCormick, whom I've introduced before, is a specialist, an expert in all sorts of things with regard to infectious disease, and he is in the right position for such a time as this. Not only is Dr. McCormick our Chief Academic Officer, but he's also serving as the chair of our task force dealing with COVID-19 and really being ready for everything that's about to happen. So thank you, Dr. McCormick.
You're welcome. Good to be here.
Hey, we have several questions, so let's get right into the questions. And so I want to ask first a number of questions asked about masks. Talk to us about masks and why is this important and what is our policy going to be on campus?
Well, thank you. It's a pleasure to be here. Thank you for the opportunity, and we welcome additional questions. Several have been submitted, so we're looking through some of those, and we want to talk about the importance of masks. For so long, I talked with the task force about really the factors that we need to be thinking about as COVID kind of developed was density and time. Density, how packed are people together and how long are they together? And that was my equation. That was how I kind of said, okay, let's look at density and time until the mask factor. And the mask factor has changed the game. They are so important, the type of mask that you have and how you wear them and that you wear them. Our masks are required on campus, in buildings, unless you can, as we demonstrated, appropriately distance, minimum of 6 feet. And we even have a little bit of extra space, right. So that's good. Masks are so important. You gotta have the right mask, and importantly, over your nose. Studies have shown that that's where so much of the leakage happens, is around the nose. So you have to have the right mask. We're providing masks to our students. So when you come to campus, you're gonna have the right masks. A little bit of data. Some of you have already seen this study, and it's so important. You've heard the study about the stylists at the hair salon. Now, it doesn't apply to me because my haircut doesn't take very long. So there's not very much time that's involved with that. But the study showed that 2 hairstylists who ended up being COVID positive, they provided styling service to 139 people. All of them wore masks, so the stylists wore the mask, the clients wore the masks, and they were exposed over a period of time to COVID. 0. None of them came down with COVID. Wearing masks is so important. We've got to comply with wearing masks wherever you're at. You go into a building, you're wearing your mask. Go into your dorm, you're wearing your mask. If you can't social distance, you wear your mask. I think that's pretty clear, Mr. President.
Man, Dr. McCormick, thank you. That's very good. And my guess is my haircut takes even less time than your haircut.
Do you do a drive-through? Is that what you do?
Yeah, pretty much. Hey, listen, and I appreciate your mask matching your shirt, and I want to congratulate you on that good-looking polo you're wearing today.
My wife gave me this matching mask.
Okay, very good. Hey, let's go to another similar topic. You've talked about masks. Talk a little bit more about the physical distancing.
Distancing, and so often we hear the term social distancing, and while that is used, it's common. I tend to move away from that because, quite frankly, there's none of this that we're going through that's social. It's antisocial. I talk about healthy distancing. Same concept, but doing it in a healthy way. You have to maintain that distancing appropriate so that there's not that release of the virus, and we could talk a lot about the viral load. We don't need to talk about that. But you have to maintain that distancing that's required. Another little bit of science here, some studies that recently came out. Kind of a look, my wife asked me this question. She said, what evidence is there that distancing is working? What is it? Recent study, over 55,000 individuals who came down with COVID didn't survive, so they died from COVID. A look back study, 55,000 people in different communities, mainly states and communities. They demonstrated that every day that they did not proceed with implementing distancing, every day increased the risk 5 to 6% for contracting the virus. Every day that we don't do the right distancing, it increases the likelihood that someone's going to transmit the virus.
Wow, very good.
You got to stay distanced.
You know, and we're going to have lots of physical reminders on campus about that distancing. Even our brand new cafeteria, the Branch, which is beautiful and wonderful, they are changing some of the ways that they serve as we come back here in a couple of weeks. There will be a limited number of students in the service area. Opportunities that we had before to serve ourselves with salads and things like that, now those are going to be provided to us. I understand that we're also going to be wiping down very, very regularly some of the drink stations and things like that. Silverware is going to be provided to us in packages. So lots of things are taking place there that you will see on an hour-to-hour basis, frankly. Okay, I want to skip over to something important also, Dr. McCormick. Talk to us about testing, both for COVID-19, but also for the regular flu.
Yeah, I have mentioned on a number of occasions the importance of having the flu vaccine. So let me talk about that first, and then I'm going to get into the testing. Why is it important that we have the flu vaccination this fall? It's important because the symptoms from the flu look just like the symptoms of COVID. So if we encourage, not mandate, let me underscore that, we're not mandating the flu vaccine for our student body and from our faculty and staff, but we are strongly encouraging, and we're going to make it very easy to get the flu vaccine, because if we have a high percentage of participation and compliance with the flu vaccine, then when we see those symptoms, we're going to know, we're going to immediately be thinking COVID. We already will, but we're going to be thinking COVID. And we're going to talk in a little bit and introduce to everyone who our COVID clinical officer is going to be, and that's really, really exciting. So stay tuned. The COVID clinical officer it's really important to know who that person is. So the flu vaccine is so important. We're going to strongly encourage that, make it very easy for everyone to get the flu vaccine, but certainly not going to be a mandate. Testing. All of this that's been going on, and you've heard so much about the importance and accessibility of testing, and that's been a real challenge. And we want to make it so that it works for everyone and that it's easy. For those that have had the pleasure of getting tested, I'm going to, on this live event, I'm going to do a nasopharyngeal swab on President DeSteiger. Oh wait, he's masked, so we're not going to do that.
No.
So if you've had this done and know how it's done, this device goes not just in your nose, but all the way back to what's called the nasopharyngeal cavity, NP. It's not, and you do it on both, the best sampling is on both sides. Your eyes water, you kind of cough, it's uncomfortable. I used to do this in a lecture and walk around with it. I'm not going to do it now.
Thank you.
But what we've done is we've looked at the studies and are working with a local laboratory that you don't have to have that swab. When you show up on campus, what you're going to do is you're going to provide your information, validate who you are, and all you have to do is, I've never done this before, you spit into this tube. Can I do this? Is that okay?
I think you should.
Now, that's going to take more than that, but that's a little bit harder than it is. You got to spit in a tube, get a sufficient spit, saliva in the tube, and that's it. None of this, but a simple tube collecting the saliva. The lab that we're working with, I'm really thrilled that they have committed to a 24-hour turnaround time results, which means we get the samples to them by noon one day. The next day we're going to have results, and when we see something that's of concern to us, we turn to our COVID clinical officer and we start the process of either isolating or quarantining based upon the results. And it's a moving target, unfortunately. The Centers for Disease Control just came out with new guidelines this morning. For a mild to moderate case of COVID, you don't need the 14 days. The CDC says now 10 days.
Wow.
So we're going to be in compliance, and we've got a safe plan. Parents, students, you need to know. I've said this internally, and I'll say it now to this group listening. We can have a safer fall semester if we do this. If we mask and we distance and we test and we trace, we can have, and we get the flu vaccine, we can have a great semester here at Oklahoma Christian. And I truly believe that we can do that.
Boy, Jeff, thank you for that, and thank you for demonstrating that as well. Frankly, I'm glad we're doing it as the students return to campus. I know some universities are sending them out to students and having them do it on their own somewhere. As a lawyer, I really appreciate the chain of custody and the kind of observation that we're going to be able to provide and direction. So I'm glad we're doing that here. So all students, as we're moving on to campus, will take the test. And there's going to be a period of time, 24 hours before results come back. Is there something special during that 24-hour period?
What's special is that you maintain compliance. If you can get your hair done and sit there for longer than 10 minutes, like I do, where it's 30 minutes or an hour to get your hair styled, and you've got your mask on, you comply with the guidelines, you're going to be fine.
I want to move to another topic we were asked about, and that is the daily health check that we have talked to people about. Every day, our students, our faculty, and our staff will be doing kind of a self-monitoring test. Tell us about that.
Yeah, so what we've done is we've developed a system. It's a very simple process for every individual, faculty, staff, and students to go through a daily health check. It's a simple process. It's a matter of taking your temperature and kind of assessing, doing a daily assessment of how do I feel. That discipline is going to be so important.
Right.
And I think that's so much a part of it. For me, it's been really important to have that discipline of thinking about, okay, how do I feel today? And going through the process of that temperature check. We will be providing thermometers for all students. So they arrive on campus, they get a thermometer and a mask. So it's very easy for them to take that check. This will be monitored regularly by our task force, and then our clinical officer, our COVID clinical officer, will be monitoring this. We have a huddle planned every day at 3 o'clock. This task force and our COVID clinical officer will meet and kind of assess where are we at, what are we seeing, what are some challenges, what's going on, how many students do we have that we have questions or are of concern because they have some kind of symptoms. But we're going to meet regularly and assess that and take appropriate steps, whatever that may be. We've got a really good plan in place.
Boy, Jeff, that is great. Thank you for sharing that and talking about those things. Additional questions, and these might actually be some that I can help answer. First question is, can parents help their kids move into the dorms coming up in a couple of weeks? We want you, Mom and Dad, to be there and to help your student move into the dormitory. Now, let's keep it to 2 or 3 per family. Let's not invite cousins that we haven't seen for years. Let's not bring in the grandparents from all over the place. Let's not ask the cafeteria lady that you're especially close to from your high school to come back. Unless she's bringing cinnamon rolls, then we'll rethink that. But please, moms and dads, we'd love for you to help. So if each student can have 2, maybe 3 at the most to help move in, we're going to have some special ways and directions for you to move in when you're here as well. A second question talks about spiritual life on campus. What's the plan for chapel, for kudos? You're going to receive more information from that. Summer Lashley, who's our Director of Ethos, and Jeff McMillan, our Dean of Spiritual Life on campus, boy, they've been working on this. They're getting lots of good input. They're putting together a really, really great semester for us spiritually. We are going to do Big Chapel differently. We can't have 1,150 students and faculty and staff packed into Baugh Auditorium every day, Monday through Friday at 11 o'clock. We're going to reduce the kudos requirements, but we're going to give you some opportunities in smaller alternative chapels where you can socially distance and wear your mask. We also have a special Bible study, five Bible study series that Jeff McMillan is working on out of the book of James that I think is really going to be special for our campus. It's going to be a really good semester spiritually here. Another question is, what's the plan for big events on campus? We have some traditional events that are so special. First week follies, freshman fanfare, homecoming. Well, let me talk about our emphasis. We think these are an important part of campus life, and we really want to celebrate and do these in ways that make sense during the coronavirus era. So, first week follies, freshman fanfare, they will be happening on campus, but not in Baugh Auditorium. We're going to do those things outside, and we really want to limit participation and the fans, the audience, to those that are on campus. That'll be a change from the past, but we think it's important this time. What about homecoming? We're going to have homecoming, but for those off campus, for those who aren't living here on campus, it's going to be a more virtual experience. But our students will still participate in a traditional homecoming setting. And intramurals, what about intramurals? We love intramurals here, and we're going to have intramurals, but some of them are going to look different. In fact, I was on a conference call earlier in intercollegiate athletics in our Lone Star Conference, and we're talking about really what the NCAA is suggesting and how we're going to move in intercollegiate play. So we're going to have intramurals, but we're going to do them in some different and special ways. So be a part of that. Okay, a couple more questions for you, Dr. McCormick. We will have positive COVID-19 cases on campus this fall semester. I think we all understand that that's going to happen. We want to mitigate, though, what happens at that point. So let's say a student or a faculty member or a staff member tests positive for COVID-19. What happens?
Well, I'm going to talk about that from a couple of different standpoints. Number one is what happens in the classroom. We have, I don't need to tell you this, Mr. President, but I'll tell everyone watching, we have amazing professors here at Oklahoma Christian, and they, in a magnificent way, kind of shifted the learning environment whenever we had to go online just a few months ago. And we learned a lot from that. So what we are looking at in the classroom is what we call an OC Flex mode. And that OC Flex mode will allow for those students who need to be isolated or quarantined to move in and out of the classroom and move into a remote learning environment or online learning environment. And our professors are planning and have something in place for that OC Flex. So we're ready to accommodate for that. We also have a fantastic support staff. Candace Bass leads an amazing team as far as from the residential halls, the apartments and the dorms. We've got a plan in place so that we can appropriately accommodate those individuals that need to be isolated or quarantined at the right time. So we're going to be monitoring that on a regular. That'll happen in the huddle. So the huddle every day, when we see that positive show up, we're going to accommodate appropriately for what's needed. I'll also mention that I didn't bring my certificate, but I want everyone to know that a number of us went through and are certified by Johns Hopkins University for contact tracing. Well, what does that mean? That means that we have a system in place and we have gone through the right educational steps so that we're going to be able to be involved in tracing those contacts whenever we do have that positive. The positive can happen at the student, positive can happen with the faculty, a positive can happen with the staff, and we've got an amazing plan. Our roadmap to readiness for this fall is a 60-page document that really details out exactly what we need to be doing.
So, and it is an outstanding plan. I want to thank you for leading it as it was put together. So a student tests positive for COVID-19. They are isolated. We have rooms set aside on campus where they will be helped move. Mm-hmm. They will stay there. Meals will be delivered to them. They'll be able to continue in their classes virtually. And we're not going to let them be isolated socially. We are going to stay in contact with them.
That's exactly right. And I'll also mention that when we talk about OC Flex, it's not just the classroom. Our counseling center has set up a flex model for counseling. And we want to make sure that we're responsive to all the needs of the students, not just their physical needs, not just their getting the meals to them. Those are important, but we also want to make sure that we're supporting them with challenges that they may be facing from mental health issues.
Jeff, one of the questions came up, and I think it's pretty simple to answer. The question was, during the semester, will students be able to be in touch with their professors in person? The answer is yes.
Answer is yes, absolutely. We want to maintain that in a healthy way. We want to maintain that connectivity with professors and students. Yeah. It can be done.
Man, I tell you, OC is so blessed to have Dr. McCormick and his team here. We have lots of questions. If we didn't get to your question, man, please, you can email questions to us, concerns you might have, to covid19update@oc.edu. I also, here as we wrap this up, I want to mention that we do have a COVID clinical officer. Dr. McCormick mentioned. Why don't you tell us who our COVID officer is?
We have some amazing individuals that could step in and serve in that role, but there's none better than Shauna Hood. Shauna is a chair of our School of Nursing. Shauna Hood recently returned just a week or so ago from serving 8 weeks at a hospital in Staten Island in New York, the epicenter of where we saw COVID happening. Who better to step into the role of knowing how to manage and to respond to the needs of the individuals who are developing or have symptoms associated with COVID. So Shauna's going to be great for that, and she's a take charge person. She's going to make sure that this happens right. So thrilled to have her.
Jeff, you're right. Shauna is great. I mean, when you're a place like OC and you've got people with the expertise, but also with the heart to serve, it doesn't get any better than that. Kim Langford also served in a similar way in New York City, and I'm just so proud of these folks. So I'm so glad that Shauna is going to be serving in that role. If you have other desires to see information as we post it, I want you to go to oc.edu/COVID-19. Our communication staff is really keeping us all updated very, very well with that. We can't wait for your students to be back with us on this campus. Your students make this place special, but so do faculty and staff that care about this entire community. We're taking lots of steps to make it as good as we can this university. I want you to know that I, even in this building, am taking steps to be ready for this semester. I've got a glass jar of peanut M&Ms on my desk. My wife gave me a scoop a couple of years ago to increase the hygiene factor there. Students are always welcome to come. I've set that jar aside, and now I have individual fun-size packets of peanut M&Ms. So come and see me, wear your mask. I want to share those things. I also want to say that not only has the technical aspects of what Dr. McCormick has put together for this semester been very, very special, but I really love the spiritual direction we're taking with it. When asked what the most important command was, Jesus said, love God with everything, but he said the second most important command, right up there with the first, is to love your neighbor. So we're going to be doing things like wearing these masks and socially distancing because we're going to be taking care of each other. We're going to love one another in that way, and there's not a better university for that to be the case. God bless you. Thanks for tuning in. We can't wait to have you back on our campus. Dr. McCormick, thank you.
Thank you.
God bless you all.
Bye-bye.